Hello everyone, welcome back to my channel. Today we are going to study about pathophysiology of inflammation. So I'll be teaching you these all on the highlights of this video. I'll make it as short as possible and as informative as possible. So let's get started. First of all, we'll discuss about events in inflammation. There are totally three events of inflammation: alteration, excitation, and proliferation. Later, I'll discuss about the types of exudative inflammation, and at the end of video, I'll tell you about acute and chronic inflammation. So having known this highlights, let's get started. First of all, the alteration. What does alteration mean? Alteration is characterized with damage of tissues and cells in the site of inflammation. It can be of two types: primary and secondary. Primary alteration is the direct action of the pathogenic factor damaging the cell membrane, releasing intracellular enzymes from the lysosome. So this is called as lysosomal effect. Water electrolyte disturbance, synthesis and activation of inflammatory mediators. The mediators such as histamine, serotonin, prostaglandin, leukotriene, and cytokines. Cytokines further include interleukin and tumor necrosis factor alpha. So, by this stage, the mediators are synthesized in the primary alteration. Please remember, the next is the secondary alteration. Secondary alteration results in the disturbance of local nervous system, changes in the microvascular blood flow. All the metabolic processes are greatly intensified and qualitatively changed in the site of inflammation. The metabolic processes include what? Metabolism of carbohydrate, lipids, proteins, right? So, in the carbohydrate metabolism, glycolysis takes place; in the fat, lipolysis; and in the proteins, proteolysis. Easy to remember, right? Alright. There's one big phenomenon over here that you have to remember is the catabolic reactions prevail in the early periods and anabolic at the final stages. What does catabolic mean? Catabolic means the breakdown. Please remember, the catabolic means breakdown. Students mostly confuse between catabolic and anabolic, so I want you to remember that catabolic means breakdown and anabolic means to form. Alright, having known this, let's move on further. What are the changes in the vascular flow? In the vascular flow, blood flow, it begins very early after the injury as a result of tissue alteration. So as a result of this alteration change, there are certain vascular events inside the blood flow. So what are those alteration changes? Let us see. First is the arterioles constriction. In the capillary uh, way, how this capillary build? It is made up of arterioles, arteries, venules, and veins, right? So there, the mixture of blood takes place in the uh, capillaries. So the first, what happens is the arterioles get constricted as a result of activation of sympathetic nerve. Sympathetic nerve. So This you have to remember. Again, the students confuse here between sympathetic and parasympathetic. Please remember that arterial constriction is due to activation of sympathetic nerve. So as a result of arterial constriction, the blood flow will increase, right, due to constriction. So why is this constriction taking place? In order so that the inflammation cannot spread to the other tissues. That is the reason why the arterioles are constricted. Next, what happens is the arterial hyperemia. Arterial hyperemia is blood flow increase due to vasodilation. The scenario here will be changed and the blood flow will be increased to a high extent, and it is clinically represented as heat. The temperature of the skin will be increased. So that is observed in the form of heat and redness in the area. All right. The next is the venous hyperemia. Now, due to the long vasodilation observed in arterial hyperemia, there is slowing of blood flow in the next stage that is called as venous hyperemia. Now, the venous hyperemia is observed as cold and paleness. The temperature of the skin becomes cold and it observes as paleness, whereas in arterial hyperemia it is observed as heat and redness. These points are also very, very important to solve multiple choice questions in your exams. All right, next move on to the next stage. The next stage is characterized as pre-stasis, and the last one is called as stasis. So in the pre-stasis, what happens now that the blood is moving slowly? What happens is that the blood starts to rush back and rush forth. There will be penduliform movement in the mm, area of the skin inside the blood vessel. All right. Next leading stage is called as stasis. In the stasis, what happens is there is peripheral orientation of blood cells in the vessel. As a result, these blood cells stop the blood flow to the surrounding as mentioned, and it will lead to a clot formation. So that is called as thrombosis. In the previous video, you can go and watch. I have mentioned about thrombosis as well as venous hyperemia. Please remember, as a result, there is complete stop of blood flow in the following stage. That is called as stasis. Stasis means complete stop of blood flow. These are all the events undergoing in alteration stage. The next stage is called as exudation. In the exudation, it is mainly formed like the exudate. Exudate is formed because of three reasons. These three reasons for you to remember is really very important. Please remember these three stages. The first one is called as increased vascular permeability due to increase of blood flow, increase intravascular hydrostatic pressure, and increase osmotic and oncotic pressure of interstitial fluid. These 3 points all are concerning about increase, right? Please remember. Now let's move on to the types of inflammation. There are totally 7 types of inflammation. Exudative. Please note that these are exudative inflammation, right? So the first one being the serous inflammation. The serous inflammation occurs in the pleura, pericardium, and peritoneum. So you can remember easily as 3Ps, right? You can remember as 3Ps. All right. The cause of serous inflammation is due to thermal injuries or certain chemicals, infections, allergic agents, or any other cause. So inside the exudate, there is presence of neutrophils and certain amount of protein. All right. Next is the catarrhal inflammation. Catarrhal means mucus. There is presence of mucus and certain blood cells like white blood cells, lymphocytes, and epithelial cells in the exudate. For example of this kind of inflammation is seen in rhinitis, like the presence of mucus more is there in the nose. So rhinitis, gastritis, and enterocolitis. These are the most common types of examples in catarrhal inflammation. All right, let's move on to the fibrinous inflammation. The fibrin deposition takes place in fibrinous inflammation. So it is most commonly observed in the pericardium and the pleura. So it can be of two types. Please note, can be lupus or it can be diphtheric. So in the lupus, it is formed mainly in prismatic epithelium. Prismatic epithelium is observed in the larynx, trachea, and in the bronchi. Or more commonly, you can note it as respiratory pathway. The diphtheritic inflammation is observed in the squamous epithelium. So it can be in throat, pharynx, and tonsils. All right. Next one is purulent or suppurative inflammation. The purulent or suppurative inflammation is where there is formation of pus. This point to be noted is very, very important. This formation of pus containing white blood cells, tissue debris, and bacteria. The bacteria of this type can be Staphylococcus or Klebsiella species. Please note over here that pus is different from abscess. So as I said, the pus is composed of this kind of debris, whereas an abscess is when the inflammation process is severe and it is localized and it can produce discrete focus of separator, suppression, and necrosis. It is called abscess. The next type is called as phlegmonous inflammation. Phlegmon, alright, please remember. It occurs in the skin, subcutaneous tissue, skeletal muscle, and appendix. It can be caused by streptococci, which elaborate enzymes like hyaluronidase and streptokinase, and it allows the spread of infection. So this is most commonly observed in the skin, subskeletal muscle. Please remember. Alright, having known about this, let's move on to the next type called as putrefactive inflammation. Putrefactive. It is caused by a certain bacteria which can get dirty green in color. These are the specifications of this type of inflammation. So it can get dirty green in color, flabby. It can creep away with formation of bad smelling gases. Alright. There is formation of bad smelling gases. Please remember. And it is caused by the bacteria known as Pseudomonas aeruginosa. The next one is hemorrhagic inflammation. It is caused by the damage of endothelium from the toxic influences. These toxic influences can be from the plague or anthrax or leptospirosis. The septic infections I'll deal, these are all called as sepsis. Other word is sepsis for this. And I will deal for this sepsis in the next video. Alright. Moving on further, the last stage of inflammation that is called as proliferation. In the proliferation, what happens is proliferative cells get abandoned, means there will be an enormous increase in its number so as to cause organization and repair. So the proliferative cells are nothing but fibroblasts, the main ones. The fibroblasts are the main proliferative cells to be remembered. The other ones can be endothelium, endothelial cells, fibroblasts, histiocytes, and parenchymal cells. So this is to be remembered, very, very important point. So these changes mostly cause organization and cell repair. So these changes are most commonly found in the chronic inflammation. So that it will take some time. It occurs very slowly. Alright, please remember. So the etiology means nothing but in pathology we call it as cause. It's the cause. Alright. So etiology can be infectious or it can be non-infectious. Infectious, as mentioned, can be syphilis, tuberculosis, rheumatism. So I'll deal with each topic of them separately in separate videos. Or it can be non-infectious like silicosis and asbestosis. For now, please remember the etiology. I'll explain them in detail in the upcoming videos. So the last part of our video is the acute and chronic inflammation. This difference for you to know is very, very important. So what happens in acute is the duration is short, within days limit. In chronic, it's long weeks to months. The inflammatory cells involved are mainly neutrophils and macrophages. So you have to remember a point that in the inflammation side, the neutrophils come first, followed by monocytes, and then by the lymphocytes. This is very, very important for you to understand and to note it down. Alright, please remember. So the next one is exudation. As mentioned earlier, exudation is seen in acute inflammation, whereas in chronic it is not seen. Chronic, what type of inflammation is seen is proliferative inflammation, right? Proliferative, mentioned over here, chronic inflammation, all right? Next, the local signs are present whereas absent in chronic inflammation, whereas the systemic signs like high fever are present in acute and low-grade fever, weight loss, and anemia is observed in chronic inflammation. So this is our end of the video. Thank you for your support and response. Please follow my channel MedText and share as much as possible. And don't forget to subscribe. Thank you so much.